breathing. It's a luxury that almost all of us take for granted on any regular day. I know I did. I'm sure all those who suffered through COVID and lived through different symptoms also faced the same issue. You don't realize the severity of it until you're going through it, because at the start, it just feels like a flu. So we have again with us Dr. Jayalakshmi, who's going to answer a few questions for us. So doctor, what is the difference between coronavirus and a normal flu in terms of lung impact?
So the normal flu, it usually comes with fever. Lungs are usually not directly involved. Whereas if you see the corona, it directly involves the lung. Even in patients with very mild illness, when we do a CT scan, we find shadows in the lung, which we don't see in the normal flu. In the normal flu, lung gets involved in patients who are already having pre-existing lung disease because of superinfection.
Doctor, what is shadows in the lung?
So the shadows in the lung are basically a type of pneumonia of the lung.
Okay.
So it can be because of, where it affects the lung. So it can be because of lot of fluid oozing into the lung, or because of lot of immune cells of the body oozing into that part of the lung, or because of small blood clots which affect the vessels in that part of the lung.
Caused by the virus.
Yes.
Doctor, how severely can a person's lung be impacted by the virus?
So as we have been seeing, the lungs involvement, which can be of different severity, is the most scary part of this coronavirus infection, and it is the most common also. And severity in the extent we find patients who have been absolutely okay the day before, and within 2 days or even 1 day they have extensive both lung which is completely involved with the virus, to such an extent that they are not able to breathe properly. They are not able to take in oxygen. So the lungs are not able to take in oxygen. So you may have seen that ubiquitous pulse oximeter.
Sure.
So that shows the saturation of oxygen in the blood. So that oxygen comes into the blood only when it is taken in by the lung.
Sure.
So the lungs lose the capacity to take in the oxygen to various extents.
Sure.
So the lungs have a lot of reserve. So unless they are involved more than say 30%, they may not show up also. They will still take up enough oxygen so that the pulse oximetry reading may be normal. So up to 5 or 10% lung involvement is seen even in the mildest cases if we really look at their CT scans, or sometimes it is not seen.
Sure.
So we would say about of the symptomatic patients who come, there would be maybe 50% or more of patients who are having lung involvement.
Wow, that's a lot.
Yes.
That's a huge number.
Yes.
Doctor, what exactly happens to the respiratory system when a person is infected by COVID, and how can a person take care of their lung health and rebuild their respiratory immunity?
So the way COVID affects the lung is, we know it starts as a viral infection, first affecting the nose, then the throat, then it moves down into the airways, and then it goes into the lungs. So it hatches onto the cells in the lung, and it starts multiplying inside the lung and inside the airways. So as it multiplies, the body mounts an immune response. So it is this immune response actually which leads to lot of damage in the lung per se, because there are a lot of cells and liquid which ooze out into the lung at that point.
Sure.
And which fill the lung and which prevent it from functioning properly. Also, COVID has a tendency to increase clot formation in the body. So that is why when we are treating COVID, often we give the anti-clotting medications to the patients.
Sure.
So these tiny blood thinning medications. So these tiny clots clog up the blood vessels in the lung, and that causes, it's called as pulmonary embolism or pulmonary thromboembolism. Which can be picked up with a CT scan, a special type of CT scan where you inject a dye into the vessels and see the clots actually. And these are also one of the ways by which the lungs are involved.
It's a lot of damage. I'm glad that we are talking with you, because we're learning so much more about and getting so much more information about the virus that we didn't know. Doctor, another question, an important one. What must a person do in case they face breathing problems during COVID, and what can a person do at home to help strengthen their lung capacity post-COVID recovery?
So as we are seeing, we advise the milder cases to do a home quarantine. So basically they're at home.
Yes.
And the main thing what we ask them to watch out for is a fall in the oxygen saturation.
Sure.
So if he's really having breathing difficulty, it means that the lungs are affected. Many patients with COVID don't have breathing difficulty, especially the mild cases. But if it is moderate or severe, that is when the breathing difficulty actually starts. Usually these patients also have a fall in the oxygen saturation. At such time, they should immediately contact their doctor or come to the hospital and get their lungs examined, preferably by a CT scan or an X-ray if a CT scan is not available, and so that we can see the extent of the lung lesions. These patients would probably require admission, medications, oxygen. Steroids are shown to have a good effect in improving the lungs in these patients. So usually they would require that treatment. They would also require blood thinning medications probably. So such patients, if you have COVID, you are undergoing home quarantine and you develop breathing difficulties, you should get in touch with your doctor. Probably may require admission.
Doctor, one of the most important questions today that are being discussed and asked is how important do you think is a vaccine post-COVID? What are your thoughts about that?
So I'm very glad you asked the question, because post-COVID infection, we do develop a good immunity to the disease. It has been found now in the studies being carried out that the immunity lasts definitely for a period of 6 months, maybe up to 9 months also, because we have been seeing this illness from February in the other countries from January as well. So if you have this immunity, should you still take the vaccine? If you have not got the illness, should you take the vaccine? So my answer is definitely yes. We are very fortunate, and it's a result of a lot of hard work that a vaccine has come out in such a short period of time. It's actually unprecedented. I know the word has been used many times in COVID, but really there has been no vaccine which has been developed so soon and with so many studies.
Which is a scare, to be honest, that everyone feels scared to take the vaccine because they think it's come out so quickly.
Yeah.
Is it well researched, or or is it just better to not take it? So it's a great question.
So these vaccines which have come are a new technology of vaccine, which has been there for a few years, but which has finally got developed very well.
Okay.
With this coronavirus vaccination,
Sure.
especially the mRNA vaccines which have come, which have been developed by Pfizer and Moderna.
Yes. There are two vaccines.
There two are mRNA vaccines, and the Oxford vaccine has a viral vector technology, which is a more traditional technology. But all these vaccines have an efficacy of 90%, which is very good efficacy. It's like almost equivalent to the efficacy of a measles vaccine, which is universally given. And whatever studies have been done till now show a very good safety profile of the vaccine. So whether you have got the COVID infection already or not,
you
it
suggest
would be
we should take
definitely
it.
advisable to take the vaccine.
So here we go, friends. The tips on some healthy breathing, more awareness. In case you face breathing problems, don't stress about it. These are troubling times for all of us, but I'm sure we'll get through it. So don't stress, folks, just keep breathing. And thank you, Doctor, for your inputs and all the great information that you've given us. It's going to be of great help to all of us.